Hi everyone, I'm Dr. Sikha Garg. Let's discuss about insulin resistance today. It's a very interesting topic and very much useful. Why? Because India is leading capital of diabetes. Younger population is getting diabetes. Of course, we had family histories, but there are so many people without family history still getting diabetic. So why is it happening? How can we prevent it basically? Or we can try to at least make it a bit longer time of duration where we are not actually diseased. How can we check our health for this? So we need to get tested for our fasting blood glucose levels, your HbA1c, which is 3 months average sugar levels, your fasting insulin levels. So if you check this, and if you have a family history of diabetes or other gestational diabetes or risk factors, go in for your C-peptide as well. So what we do is, why do we need to get tested about this? So when the glucose or the insulin levels are more, that means insulin is resistant. Your body is resistant to that normal insulin. I'll tell you how it works. So when the glucose is more than normal, but it is not in the range of diabetes, you are in the range of pre-diabetes. HbA1c falling in the category of 5.7 to 6.4 is pre-diabetes. So now let's come to insulin, how body works. So when you eat something, our body is secreting insulin, pancreas is secreting insulin to utilize that food or carbohydrate or and convert that into energy. But because of the various reasons like stress, like our lifestyle, like eating lot of processed sugar, like a family history of diabetes or so many other factors, there could be a situation when your body cells are not able to utilize that insulin. So what your body do, it will produce more insulin because you have already taken that food. So when that insulin is being produced more to utilize that much of, with time, that effect will also reduce. There would be higher insulin, which we call as insulin resistance. But what would happen? The cells, glucose which we have taken will not be converted to energy because it is not well utilized. And then that food which we have taken, which has supposed to be converted to energy, will be converted into fat and stored in the body. When it is stored in the body and there is a fat and not enough ATP or glucose to be utilized by the body, you will feel tired, you will feel hungry. So you will eat again. So this is a cycle. So that way you will keep on eating more, hogging more food and still feeling tired, low energy. So you will also wonder, you eat a lot of food and good food and still why you are tired? Because the insulin levels, insulin resistance is there. So this is the thing. So I told you already how to get tested and then interpret your reports. If you are not able to understand it, you can contact me anytime. Numbers would be given in the description box, also at the end of the reel or a video. You can change your lifestyle, start working out, start exercising. That's ask them about all these tests, ask them about the utilization of the test. Even if you feel tired, if you are in pre-diabetic, it will be difficult in the start, but or you are diabetic, or cycle would be set. It all depends on your reports, and your diabetes and of course will also be cured. So if you are symptoms of insulin diabetic are resistance are usually off diabetes alone levels. Like you will feel exercise and can eat more medications. You will feel tired. There will be high blood overweight or obese. In the range of middle range, your weights right higher than normal, but not in the diabetic range. Meet your dietitian. Apart from that, there will be dark skin patches. All this has to be done in a healthy way. This also happens due to insulin resistance or in diabetes where the hormones are not balanced. Apart from that, tingling in the hands or feet can happen. Certain vision problems can also happen. So all these could be the common symptoms of diabetes, which are not apparently diabetes, but you are in a pre-diabetic having all those symptoms. So if you are having symptoms, go test, get tested for your blood glucose level, your HbA1c, your insulin levels. All these are very important. So there would be of course low energy, and there would be hunger after meals also, tiredness still there. There would be sugar cravings also because your energy is not met, so body will ask for more sugar because that's directly converted to insulin. So basically apparently there would be no symptom, but there would be weight gain and other symptom. Right. So what you can do for this is get tested, and in the modifications, lifestyle modifications are very important. You have to cut down on all the sugar sources or processed sugars. Natural fruit sugar is okay, which you are taking as a fruit, not as a juice, but otherwise white processed sugar, jaggery, any other kind of sugar is all no. change your lifestyle, start working out, start exercising. That's very important because your body will be able to utilize. Even if you feel tired, go for the walk. It will be difficult in the start, but eventually that cycle would be set and you will feel much better, and your diabetes will also be cured if you are diabetic. If you are not diabetic, pre-diabetes, still you will be able to manage your blood glucose levels if you start your exercise and your modifications. Weight monitoring is very important. If you are overweight or obese, check that, get your weights right, reduce it, meet your dietitian, meet your doctors nearby, contact me if you want. All this has to be done in a healthy way. Don't go for the crash diet, right? In the long term, healthy way of reducing weight is very important. Otherwise, there could be other hormone imbalances can happen. In patients, females having PCOS, they need to get it checked nicely and properly, and then get treated properly. Do not miss it. And if you have a family history of diabetes or a risk factor, then of course you should get tested very nicely, frequently, after 3 to 6 months, depending upon the age group. Also, anybody above 35 has a more risk, so they should get checked very frequently. So another test is called the C-peptide test. That is, again, it will help you in diagnosis of what kind of diabetes you can have, or there is usually it's used for to diagnose which kind of diabetes we have. So it's a good test, very very good test, because your body is making that C-peptide. So it will tell you how much insulin is, we take that ratio of C-peptide insulin. That's for doctors use, but you need to get tested. It will be helpful in diagnosing your diabetes. So it's important, if you are in a risk factor group or in a pre-diabetic group, in a high risk group, all this has to be checked. For further details, you can directly contact me through WhatsApp or to phone calls. The number would be given in the description box. Please do subscribe, like and share my YouTube channel. I would be very very much thankful. Thank you for all the love. Thank you so much.